One of the major legacies of this government with regards to healthcare is access to healthcare is reducing. So, little by little, in every route to healthcare, it's becoming more difficult. And this can be seen at GP level, it can be seen at ambulance level, it can be seen at overcrowded ED level, and it can be seen with regards to waiting lists. So, in this state, we had 601 people on trolleys in a single day. In my own region, Navan Hospital and Drogheda Hospital, we've had last year 9,000 people on trolleys. Now, that's the exact population of the town of Trim, all on trolleys in 1 year period. This is a shocking scenario. And what does that lead to? It leads to delayed diagnosis, it leads to delayed treatment, and it leads to sub-optimum health results. In practical facts for people, it means with their illnesses becoming worse or their injuries becoming worse, and in some cases it means that their lives will be shortened as a result of it. Now, with regard to waiting lists, we've seen shocking figures. 68,000 people on inpatient waiting list, 385,507 patients waiting for outpatient appointments. 20% of the state now with no medical cover whatsoever. Budgets for disability services reduced by €159 million. 1 in 3 ambulance calls in the state that are considered to be classified as emergencies becoming late. And for example, in a 1 year period in my own constituency, I received 40 people telling me that their ambulances called had been longer than 1 hour. And in 7 of those cases, there was a fatality involved. Now, I'm not saying that there's a direct result between the late ambulance and the fatality, but there's no doubt that in many cases, health results are far less when the ambulance is very late. We have children waiting for more than 6 months on painkillers for dental treatment. We have 3,000 children waiting on mental health services. And then you have the backdrop of suicide rates with regards to that. And I wanted just one case, and I brought this in a parliamentary question to the Minister's attention before, and it just looks at a number of different aspects of the health service, including A&E. One constituent of my own in County Meath lives 4 minutes away from the hospital. She called an ambulance after having a stroke. Well, her son called the ambulance. The ambulance came 40 minutes late. She went into the hospital and she got decent treatment in Navan Hospital. But she was clinically discharged for 13 weeks, unable to proceed to the National Rehabilitation Centre due to the fact that they were under fierce pressure. She went there, she had treatment, and she got to a certain level of rehabilitation where she was able to return home and live with care from her family. Unfortunately, about a year later, she had another stroke, and she went back into the hospital and very quickly had a good recovery. However, she was brought to the shower one day when both nurses were with her. One of those nurses were called away due to the busyness of the hospital. She fell and she had a head injury. And as a result of that head injury, she was brought to a Dublin hospital. And that Dublin hospital gave her the wrong blood. And she has been in a coma for about 3 or 4 months and has had internal organ failure as a result of that, is very slowly coming back. Thankfully, her mind is showing a strong level of clarity, but physically, she is in a bad way. And at about 68 years of age, probably won't be able to go home again and is likely to be in a nursing home. Now, look at how much would it have costed to have an ambulance arrive there in time on the first occasion? How much would it have cost to have those 2 nurses be able to remain with her? How much would it have cost to have the necessary resources in that hospital to provide the proper bloods to her? And measure that against the cost of her nursing home care for maybe 20 years more. And that's the key significance here. Because the government are on a fool's errand, they're cutting, slashing back with regards to access into hospitals. People's illnesses are becoming more acute, so the treatments necessary for those people are actually becoming more expensive. So the government thinks it's saving a few quid at the start, and in the long run, the government is being forced to put more and more money into the health services. Another aspect of access in my own County Meath is any doc. Before Christmas, it was brought to my attention that there was no doctor available at all for North East Doctor on Call. So people had to go all around the country at night time if they wanted a call, or they had to go into A&E. Now, since Christmas, we've been told that a family of young kids went into Northeast Dock in the locality and had to wait 4 hours for treatment, where there were dozens of people in a room that wasn't built for dozens of people, and where any dock cover had to go from Drogheda over to Atboy because the cover wasn't in Meath. And that means the whole of Louth is unavailable for doctor on call. So what's the government's response to this? To invest in any dock? I understand the government's response to it is to run a pilot where they will have a remote doctor in a location in Dublin speaking through Skype to a patient, possibly with a paramedic there. I'd like to know the answers to, will that paramedic be able to deliver prescribed drugs to the patient in that scenario? Is a diagnosis 40 miles away from a patient to the same quality as if the doctor was sitting in that room with the patient as well? So we see that cutbacks in any dock causing more trouble for patients and more trouble for the system. Now, Navan Hospital was part of the North East group, and when we saw the hospital in Monaghan close, we saw trolley counts spike in Louth. In Cavan. When we saw the hospital in Dundalk, the A&E in Dundalk close, we saw trolley counts in Drogheda spike. And it is now part of this government's plan to close the A&E in Navan. Now, the minister came down to the hospital before and said it'll be a long time before it's closed. But current government policy is articulated through the small hospital document, the framework document. And that states that Navan will be reduced from a level 3 to a level 2. And that states that Navan will lose services with regards to coronary care, the intensive care unit and anaesthesia, which will mean that it will not be able to take the level of people within that hospital. Now, I have also received information that the national clinic leads in the HSE responsible for policy in hospital met with Ireland East managers in early December and agreed a series of changes to the delivery of hospital services in Navan, which will convert that hospital into a level 2. The hospital staff haven't been told as of yet. I was the first to tell the hospital staff about these decisions, and they haven't been told when these decisions will be implemented. The GPs in the area haven't been told about when these decisions will be implemented. And mark this, 130 GPs in the Meath area stated that the health outcomes of citizens in County Meath will be radically reduced if the government proceeds to reduce the A&E services to shorter hours or to close A&E services. Now, this is completely inconsistent with what the Minister stated, and the HSE document, the Small Hospital Framework document, is also inconsistent with what the Minister stated when he came to County Meath. So, what we're seeing develop in the state is a reduction of access into hospitals, especially public hospitals, for people who don't necessarily have private health insurance. But we do see some of the private hospitals now open up ED services, especially in the Dublin region, and they don't have the same level of trolleys, they don't have the same level of waiting, etc. So it is becoming even clearer that cleavage between those who can afford the private hospitals and those who can't. And the backdrop of this is the government gouging funds from the health service over the last number of years, gouging staff from the health service over the last number of years. And it shocks me when I ask questions of the Minister for Finance, what is your plans for the next 5 years? And the Minister for Finance said, well, our major plan for the next 5 years is to reduce USC by 3.5 to 4 billion euros. And at the same time that we have this crisis going on, Minister, you cannot have European public service delivery and European infrastructure based on American taxation. You are either rewriting the economic laws of the planet or you're lying to the people. And it is a very serious thing to allow this level of inaccess to the health service, this level of health crisis amongst people, and at the same time totally focus your tax breaks on those on upper incomes.